Hi everyone, so today I will be demonstrating. So before we start transferring the patient, first thing we have to do is first, when we go inside the room, we should knock at the door. Okay? When you are already inside the door, before we approach the patient, we should do hand hygiene. And while doing hand hygiene, be sure that you should know where to put your wheelchair, that where you will transfer the patient, and always consider before transferring the patient, we should know that we have to identify the patient by checking the ID band on the wrist and by asking the full name, first name, middle name, and the last name. And we have to check also for the medical record number if it's in the system, you're practicing in the facility, or you have to ask the patient if there is what is the birth date of the patient. If another thing that you will do if the patient is a bedridden, we will just rely to the notes that the order of the doctor, who is the patient, we should know who is the patient and what's the full name, then check for the ID band. Okay? Now, let's start transferring our patient. Okay? Since I have a patient here who is a bedridden, all we need to do is just take first the linen out. Okay? Then, first, check for the patient's vital sign if it's bedridden or the patient is stroke or have neurologic condition before getting out of the bed. We have to consider a probable orthostatic hypotension because of lying down on the bed for a long time. In the hospital setting, there will be a rails here on the sides, one for the upper and one for the lower, or there is a one pull on the sides only, one pull rails. Okay, and usually take note of the hospital bed. It will be tilted up, going up. So we can start with that to prevent orthostatic hypotension. Okay? But in the home setting, there will be no such bed that it will lift the patient. So, first thing we have to do is check for the vital sign before proceeding to the transfers. Okay? After checking the vital signs, everything is okay. Now, we'll ask the patient to go on side lying. Okay? Okay? While on side lying, now we can ask the patient to move her both leg down and lift the arm and head up. Okay? Okay? Then, when we do this one, we have to ask the patient, when we do side lying, we have to ask the patient if she's feeling dizzy. If not, we can proceed on this position. Then again, we have to ask the patient, sit for a while, ask her if she's feeling dizzy. If not, we can proceed going to the bed. Okay? Side, lift up, and side. Okay? Then, help her with the legs to extend. Okay? Arm. Ask her, if there's a lifter, ask her, or if she can move, ask her to move a little bit on side. Okay? Now, that's our transfer to bed. Okay? Now we will put the patient's linen back before leaving the patients. Before you leave, you should take into consideration taking vital signs again after transferring back the patient to the bed before leaving the room of the patient. And after that, we should do another hand hygiene before leaving the patient and removing our PPE. And that's for transfers of bed to chair and chair to bed. Thank you.